Today we're going to talk a little bit about this exciting imaging technology that we have in our facility and how this technology helps us as upper cervical chiropractors. So this imaging is known as cone beam computed tomography, or CBCT for short. And if you're familiar with this technology, it's most likely that you've been introduced to it through the dental profession, specifically in the fields of endo and orthodontics, oral surgery, TMJ analysis, or the imaging and analysis of maxillofacial surgery and care. They began utilizing it to help with improvements in diagnosis and treatment, as well as precision in dental implant placements and so forth. So they quickly realized how it allowed them to evaluate their area of interest to a greater degree, and then its use just kind of expanded from there. In short, x-rays are a fantastic tool, and when necessary, we also have digital x-rays in our facility. However, they can be limiting in the information that they provide. So with digital x-rays, we get 2D images of 3D objects. And as humans, we are of course three-dimensional. And so wouldn't it make sense to get and to see 3D imaging of the actual structures that we're needing to assess and analyze? And that's exactly what we can do with this imaging here. So in under 10 to 30 seconds, this device will rotate around you in a 360-degree fashion, and it will render that 3D image. We can then take that imaging and it can be reviewed, rotated, and then slices can be isolated and manipulated to get a more in-depth analysis. So like previously stated, this in turn allows us to get the best information that we can, which is critically important when it comes to the specificity in the upper neck. This area is the most complex joint in the entire spine, both biomechanically and neurologically. Not only that, but the top two bones in the spine, they're also the most mobile bones in the entire spine, and they can have many malformations and anomalies to them. So with that kind of being said, they are, the top two bones in the spine, they are easily the most paramount and compromised joints, and due to the important neural components that they are integrated with, they can play a critical role in our overall health and our function. Therefore, it makes sense that getting the most detailed and precise analysis of them in a three-dimensional way is the way that we'd want to go. So it's important to clarify that medical CT scans are significantly different than cone beam CT scans, with one of the biggest and most important differentiating factors being that their level of radiation dosage is a sizable difference. Traditional medical CT scans have a very high radiation dose associated with them in comparison to cone beam CT scans. There's a lot of factors that are at play when it comes to measuring radiation dosage with a CBCT. That would be field of view, so how much of an area you're trying to see, the volume of tissues, the anatomical region that you're being examined, etc. But just to put a few things into perspective, we'll discuss a few dosage examples. To do that, we need to discuss radiation dose units. So first, we would want to know that the average yearly radiation dosage for an individual in the United States is around 6.2, what's known as millisieverts per year. Half of that is coming from natural background radiation. So again, natural occurring background radiation is around 1.5 to 3.5 millisieverts per year. And background radiation is that in which we're exposed to as part of our daily living. That in which we get from cosmic rays, rocks, soil, inhalation, ingestion, etc. So natural occurring background radiation is the main source of exposure for most people. And now that you kind of know those numbers and you know millisieverts, if we take that decimal point and we move it over just a few places, we can talk about microsieverts, which is of course even less than, and that's what we have to use to talk about x-ray and cone beam imaging, because that's how small we have to go to talk about dosage from these forms of imaging. So 0.1 millisieverts is 100 microsieverts, which is roughly around 10 days or a little over 1 week of naturally occurring background radiation. So every day we get about 5 to 10 microsieverts of background radiation depending on where you live. So if you lived in Colorado or the mountains, that would be higher. But the ICAT next generation cone beam, which is what we have here, can be around 45 to 83 microsieverts depending on the scan that we do. So that can be anywhere from 4 to 8 days of background radiation. If we take that and we compare it to a traditional medical CT of the belly and pelvis, for example, that's 10 millisieverts, which is around 3 years of background radiation. If you're to take that traditional medical CT and do a belly pelvis scan with and then again without contrast, that can go up to around 7 years of background radiation. So when we're discussing cone beam CT versus traditional CT, which traditional CT definitely has its place and serves a purpose, just know the levels of radiation dosage are not comparable, with cone beam CT being significantly less. So again, just to kind of wrap things up in all, This advanced imaging is gold standard for the work that we do as upper cervical chiropractors. And if we're going to get imaging of the neck, we want it in 3D, low dose, that's equivalent, similar, or even less than other imaging procedures. And it takes less than 10 to 30 seconds, surpasses the obstacles of 2D imaging, and it provides us with high quality sub-millimeter resolution images with a low radiation dose, all benefiting both the patient and the provider. It's an amazingly useful tool to analyze the craniocervical junction or your upper cervical spine to know, see, and precisely measure the type of misalignment you have and how it needs to specifically and gently be corrected. So if you or any of your loved ones are interested in this kind of specific chiropractic analysis and care, we'd be happy and we'd be honored to help you and to welcome you to our facility.
Currently, as the only chiropractors in the state that perform and utilize this technology, we're incredibly excited to be able to offer this amazing advanced imaging in-house. So give us a call today as we look forward to meeting you.